Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and I am back in this hot sunflower house for a new edition. Actually, it's a reprise edition, but there's some new information. I recently re-listened to my podcast interview with esthetician Lori Skarsko from season 1 called Top Skincare Tips from an Esthetician. And when I was listening, I forgot some of the wonderful skincare tips that Lori shared with us throughout the interview. So since it was so helpful for me to listen to again, I wanted you to get to hear it again, as well as some additional tips. So I first want to go over a couple of skincare tips and tricks that I have learned over the recent years from dermatologists. I don't know why my dermatology friends and colleagues withheld some of that information, or I didn't find out about it until later. But a lot of this, all of this really is actually over the counter, and it's something that I want to share with my wonderful listeners. That being said, this is not medical advice. This is just information to empower you to be strong, be healthy, and be in charge. So one of my go-to gifts for new parents, when we had the pelvic stimulating devices, which were over the counter, and currently because of the microchip shortage, we don't. I used to give pelvic stimulating devices to treat pelvic floor problems and urinary leakage to moms because everybody gets stuff for the babies. But that's on hold. But as soon as something similar comes back on the market, I will be sure to let all of our listeners know, as well as post breaking health news on our speakingofwomenshealth.com site. We have a section under news. And we have great social media too, like Facebook and X and Pinterest and LinkedIn. And we have a YouTube channel and a Rumble channel if you want to actually watch when I interview people or show certain things on the audiovisual tapes. We're also on Instagram, which is really very, very popular. And I don't know if we're going to expand into TikTok. It kind of depends on what happens with that company. So right now we're not on that, but always stay tuned because we like to advance and get information out to our audience. So some of the skincare tips that I wish I would have known earlier, including when I was a young parent, is sickle fate. And it's one of my go-to gifts now for baby showers. And personally, in my work, family, neighborhood, my inner circle, I have had a baby boomlet. In fact, I don't know if my audience knows, but I'm expecting my 5th grandchild. It'll be Stetson and his wife Laura's 3rd baby at the very end of summer. So we're so excited. So sickle fate contains zinc oxide, which of course is in baby ointment, baby rash, diaper rash. It also has copper, and it has sucralfate, which is a protective coating. And it's great for little cuts and because it's antibacterial, and it's like a protective paste. So it helps the skin heal better. I've put it on cold sores. I put it on minor cuts and bruises, and I keep it in my travel makeup bag whenever I leave home. Another tip, which I just learned about, and what prompted me to do this little extra information on skincare tips, was from a good friend of mine who last summer when we were at the pool, she pointed to some areas on her leg, like some bruising that she says it takes forever to go away. And she was talking about her husband who complained about the senile purpura, the little purple marks that happens, bruising in older, more mature people when there's even minor trauma, especially for people that are on aspirin or blood thinners, or just with the loss of collagen that happens with aging or sun exposure. That's why we see it more on the extremities. And I only recently found out about this from our skincare folks. And it's an interesting herb, arnica. And it comes from an an herb, and it reduces skincare inflammation and bruising. So you can get it in creams, you can get it on roll-ons. And she told me how she had an injury which would have taken a couple of weeks to heal. And she immediately remembered I said, put arnica on. And she said within a couple of days, it was all gone. And her skin was presentable. So it could also help with some pain or inflammation. And another interesting kind of old-fashioned natural product that you might have remembered if you're old enough from the 70s, when there'd be gas stations that would advertise, we have DMSO. And it is a natural solvent. It stands for dimethyl sulfoxide. It's used in the lab. It's a very potent solvent. So if you have anything on your skin and then you put the DMSO on, it will deeply penetrate. So you wouldn't want pesticides or toxins or things like that on your skin, or something that you didn't want to get into your body. So even though it's over the counter and it comes in different strengths for topical ingestion, it's only classically used in allopathic medicine to install in the bladder for interstitial cystitis, which is a very irritating bladder condition. So it has been used, though, by athletes for bruises and injuries and musculoskeletal problems. Because it's a solvent and it can dissolve things, it's been also used topically on lipomas, little subcutaneous fat collections. So if you put some DMSO on the skin and then something else topically that you want to be deeply absorbed, like the arnica for bruising. I did that recently for an injury and a bruise that I had, and I was so surprised at how fast it cleared up. Now, of course, anyone who's on blood thinners, high-dose aspirin, Coumadin, Eliquis, etc., would always want to consult with their physician or cardiologist or a blood specialist before doing anything that can affect clotting or bleeding time. Interestingly, I found out when my husband had surgery and he had a blood clot from the vein, the IV access that they put in. Usually we just treat that with heat, maybe some topical aspirin or oral aspirin. I found out that actually over the counter is topical heparin cream. Hirodoid is one of the heparinoid topical creams that can be put on topical skins for superficial thrombophlebitis, blood clots, or bruising. So I didn't find it very readily available. I actually ordered it. It's over the counter, and I got it on one of our Canada drug sites. If you have not read our column or listened to our podcast on how to save money on medicines, you can get both prescription medicines with a prescription and over-the-counter products, sometimes for less money or sometimes even more availability online through various Canadian pharmacies. So trying to save money but getting really high-quality products or medications or supplements always is a big, big concern. Now, vitamin K1 is sometimes recommended by dermatologists and plastic surgeons after procedures or after skin injury to minimize bruising. And there are a lot of products that contain arnica and vitamin K and sometimes DMSO. So that's interesting because these products can reduce bruising and swelling and inflammation in the skin. But again, with any major injury or major undiagnosed skin condition, of course you want to talk with your family physician or your dermatologist, etc. But there's a lot of cuts and scrapes and, bruises and things that maybe don't need medical attention, that it's kind of nice to know that some of these topical products really seem to have a significant effect. Another thing I learned about is ferulic acid, which is many times added to vitamin C products for the skin. Now, we have a great listing of vitamin C rich foods, and it's very important. We humans do not make vitamin C. You can get scurvy, which can cause skin problems and all sorts of systemic problems from lack of vitamin C. And it's always best in terms of nutrients to ingest them in your diet for your whole body as opposed to only apply them on the skin. But the combination of vitamin C and ferulic acid helps fade sun damage, and it helps to brighten the skin. Now, there are prescription skin brightening products, laser, there's other things that the dermatologist can do for age spots. The most important thing, of course, is to protect your skin. And you can find these products that have vitamin C and ferulic acid. Also, iron oxide. I was asking Lori when I saw her recently, when I had one of the Derma Blades and Diamond Glows. Also, she does hydrofacials, which kind of takes off the dead skin and really infuses extra serums in your skin. I'm like, I for Christmas, I got some skincare products from a girlfriend, and one of them had vitamin C and iron in it. I'm like, why would they put that together? I know when I prescribe or recommend iron to women for low iron, after I evaluate why they're low in iron. In fact, my very first podcast in season 1 was all about iron. So you don't want to just treat low iron. You want to know why you have it. But vitamin C helps your gut absorb vitamin C. And what she told me, which I didn't realize, is that iron oxide topically on the skin can help protect your skin from the blue light that comes from the computer screens and phone screens. And regular exposure to blue light can cause hyperpigmentation on the skin. There's all different wavelengths of light. If you didn't hear the podcast I did with cosmetic dermatologist Dr. Taryn Murray on laser therapies for skin problems, for anti-aging, for tattoo removal, that's a great one to listen to. And red light, which is very popular for energy and other purported benefits, although we don't have a whole lot of research. You might want to read our column on red light therapy by Dr. Sobia Khan, our women's health functional medicine doctor in the Center for Specialized Women's Health, as well as the podcast. Some other common home remedies: apple cider vinegar. We have a great column on that. It can be used for dandruff treatment on your scalp. Apple cider vinegar contains alpha hydroxy acid. And alpha hydroxy acid is actually great for removing dead skin. And so some people use it to act like a toner to the skin. And they might combine it with warm water, and it might help shrink some of the pore size on the face. And you can add a little splash of lemon to help minimize sunspots or areas of hyperpigmentation. And apple cider vinegar can improve the fingernails and appearance. And a lot of people will soak their nails for about a minute in apple cider vinegar before the next manicure. And it might remove excess residue and moisture, allowing the base coat of your nail polish to adhere a little more effectively, creating a long-lasting manicure with less chipped nails. Eucalyptus oil. It's a popular ingredient in topical pain relievers, and it works by bringing either a warm or cool sensation to the skin. And studies show that breathing in eucalyptus oil before and after stressful events can help reduce anxiety. And research shows that the natural toothpaste, which contain eucalyptus, work just as well as the standard ones in preventing gingivitis and plaque buildup. There's been a lot in the news recently about removing fluoride in terms of adding it to regular drinking water. And some states have totally removed it from automatically putting it into the water supply. Some counties have done this. And so a lot of people are looking for natural products as opposed to added things to their water or their food supply or their skin care products. And there is this kind of push to look for natural things. Now, turmeric is a spice, and it has anti-inflammatory and antioxidant properties. And when applied directly to the skin, can help calm certain skin conditions like acne and eczema and rosacea. If you haven't heard our podcast on all things rosacea or read the column by Dr. Tiffany Cochran, who is a graduate of our Specialized Women's Health Fellowship Program. It's a great one. So turmeric can help give your skin a little glow. Some people will add a teaspoon of turmeric to honey and squeeze in a little lemon and make their own little facial mask. And adding a half a teaspoon of turmeric to a smoothie rich in fruits and vegetables to ingest systemically can be soothing and anti-inflammatory. Coconut oil. Well, it's one of the most versatile skin products there is. It's a proven hydrator, antioxidant, and skin moisturizer. Just the other day, I was at home and I thought, okay, I'm going to do a coconut moisturizer mask with coconut oil and put it on my scalp and hair. Because in the summer, with the extra being outside and the ultraviolet light, my skin and hair get drier and just take a lot more beating, even though I try to wear hats and even sometimes put like spray, not just sunscreen on my face and wear a hat, but also a sun protectant on my hair. So I did the coconut oil, and then afterwards I did my usual once a week exfoliator with some alpha hydroxy acid. And somehow that coconut oil must have really taken off the dead skin so that then that alpha hydroxy acid was a little bit more potent. And I went into work and the nurses were like, Dr. Thacker, were you out in the sun and not wearing your sunscreen? It really, really exfoliated my skin. So sometimes when you're using various products, even if they're over the counter, you have to be careful. And obviously, very young people and more advanced ages, the skin is generally a lot more sensitive. Now, coconut oil is very interesting because it contains medium chain triglycerides, which can have some therapeutic effects on the whole body. And it is very moisturizing. Some people use it in place of cuticle oil or shaving gels. And replacing shaving gels with coconut oil can reduce the amount of razor burns and razor cuts. And again, if you have cuts and burns that aren't too severe, a little bit of topical Cyclofate can really be very soothing and protective. And if you suffer from split ends, dry or damaged hair, like I do, you may want to make your own hair mask with coconut oil. And you can add egg or avocado to help lock in the moisture. We have a couple podcasts on all things hair, June of 2023 and June of 2024. So as we're approaching Father's Day, hair thinning is not just for dear old dad, and women are always interested in things that help the skin and the hair. So these are just some simple tips that might help improve your skin. If you've got specific concerns, though, talk to your healthcare team, your dermatologist, your nurse practitioner, your women's health doctor, your primary care physician, because you do want to have regular medical visits. And it's so important to emphasize that beauty sleep is important for your skin and your brain and your body. And having a diet rich in colorful fruits and vegetables and antioxidants and staying hydrated is so important. And here is the replay of Lori's podcast interview from season 1, Top Skincare Tips from an Esthetician. I hope you enjoy listening to this episode, whether it's for the first time or a second time, because for me, listening to it again was like listening to it for the first time. Thank you so much for joining me in the Sunflower House, and I will see you next time. Be strong, be healthy, and be in charge. Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, the Executive Director of National Speaking of Women's Health. And I am so happy to be back in this Sunflower House with you. And joining us on this podcast episode is Lori Scarso. Lori is an esthetician at the Cleveland Clinic Cosmetic and Plastic Surgery Center. And Lori graduated from the Brown Aveda Institute in Mentor, Ohio. And she received her advanced esthetician license in 2015. And she manages the aesthetic corner at the Cleveland Clinic, and that's in the Cryle building on floor 6. And I'm a frequent flyer there. And that's where I met Lori, buying great skincare products. And she works very closely with the plastic surgeons and the dermatologists at the Cleveland Clinic and is an expert on all their product lines. And she really enjoys staying on top of the latest and greatest in skincare and helping patients achieve optimal results. And as I've mentioned in some of my other podcasts on skin and hair, that I find that women will come to me as a physician, and because I'm a women's health expert, they expect me to be an expert on skin and hair and beauty, and I'm actually not. I'm an expert in menopause and hormone therapy and osteoporosis, but I certainly know that our motto at Speaking of Women's Health is be strong, be healthy, and be in charge. And when we look good and feel good, we all function better. And we women do care a lot about skin and hair. And I certainly appreciate all the skincare health and tips. And like I said, I'm a frequent flyer for some of the skincare treatments and Diamond Glow. And so I thought it would be so great to have an expert on our show. So welcome, Lori.
Hi, thank you, Dr. Thacker. How are you? Nice to be here.
Yes, and tell us a little bit more about yourself personally. I know you've been in charge at the clinic since 2015, but tell us a little bit about yourself.
Well, I am a single mom of a 14-year-old boy who doesn't appreciate skincare at all.
Oh,
Um, but I've been with the clinic for 6 years now. I do work at the store. I work with our vendors, always bringing in new product lines. And I also do treatments at the Beechwood location. We have several, but I'm there. So I really enjoy working with patients. I love seeing improvements in people's skin, love having them leave happy, and just have them returning for continuous treatment, just for skin health. It's just a very rewarding job. I just love making people happy and looking great.
oh, well, that's wonderful. And that's how I found out about your services because I have 3 sons. They're all grown now. But when they were about your son's age, they started getting skin issues and acne and weren't into doing any of the things that they needed to do. In fact, my youngest son, who's now 26, he actually had some complications from his back acne and just was in the other day to have like a major excision done. So caring for your skin isn't just cosmetic. I mean, it does have a lot of important health benefits. And lots of us are plagued with acne, some of us with dry skin, some of us with just, age spots. I developed melasma in my first pregnancy, and I had some physician look at me and say, "Here, why don't you wipe that dirt off your forehead?" I'm like, it wasn't dirt. And so, and just with aging, we want to maintain that elasticity and try to reduce wrinkling and all of
Right.
that. And I really think that the skincare estheticians, you're really well poised to help people who want to make healthy improvements in their skin and get the right products because some of these are very expensive that really make a difference. And people who don't necessarily want to do major injections and plastic surgery and things like that. So, we're going to just
Right.
dive right in. Everything you wanted to know about skincare, but didn't know who to ask. Now we know who to ask. Lori. So tell us what some of the more popular services at the Cleveland Clinic Department of Aesthetics are.
Well, the hydrofacials, Diamond Glow that you'd mentioned, peels, which are a variety of different peels, dermablades, microdermabrasion, are our most popular treatments. Really, the key to healthy skin, and which all of these do, is exfoliation. That's the key to keeping your skin healthy. Exfoliation and as well as protection, which, combined with at-home care, you're going to see healthier looking skin, glowing skin, even texture. All of these treatments, along with the products, will definitely improve your skin concerns.
No, that is excellent. So on speakingofwomenshealth.com, we have a column that talks about a lot of these services and the Diamond Glow. And when you first came out with that
Mhm.
option, I got my nurse Lily, Lily McKinney, who's been on our podcast talking about her retirement because now she's retired. But I got her that as a gift, and we posted her before and after pictures,
Yes.
and she was really glowing because we're on Facebook and Instagram and Pinterest and LinkedIn. We now just got a Rumble channel. So we're on all the social medias. And a lot of our followers are on our Speaking of Women's Health Facebook. And that's a great place to post things. So go into a little bit more detail about hydrofacial. I don't know that I've ever had that. Who do you recommend that for, and what's part of that?
So the hydrofacial, both the Diamond Glow and hydrofacial actually are both non-invasive treatments, little or no downtime. Um, what the hydrofacial does, it's all in one. It will deep cleanse. It's like it works like a vacuum to open the pores, deep cleanse, and providing easy access for extractions, and allows active ingredients and boosters to penetrate deep into the skin. So it's a really nice treatment. It uses a chemical peel, glycolic and salicylic acid, which is customized in different strengths. And that is the way it exfoliates. So it's a chemical exfoliation. So deep cleanse, exfoliate, extract, and then infuse with different types of serums that we can customize. So it's a really great treatment. It's good for all skin types and even ages. We can do deep pore cleansing for those with acne, but actual and improved texture, plump up the skin for people with more mature skin, fine lines, wrinkles. So it kind of encompasses everybody.
Oh,
There's also
sign me up. I've got to come in and get that.
no, I mean, I have people that come in once a month for this treatment. So it's a nice treatment. Really popular too, spring and summer, where people are in the sun. So, some of our stronger treatments and peels may not be ideal if they're going to be out in the sun. But this one is something that it's a nice maintenance treatment. You do have an instant glow, plump, feel hydrated, and patients just love it.
Wow. Now, how does that differ from the Diamond Glow?
That's a good question. Everyone asks me that, and I love explaining this. So the Diamond Glow, again, same thing, an all-in-one treatment. The difference between the two is the Diamond Glow uses a diamond tip to exfoliate manually, mechanically the skin. So no chemicals are involved in that for exfoliation. We do it by mechanically using the tips and exfoliating and infusing the skin with serums while we're exfoliating. So again, deep cleanse, exfoliate, extract, and then infuse. So some people may prefer Diamond Glow. Maybe they don't like chemicals, are very sensitive, or maybe allergic to salicylic or something in the chemical peel. Maybe they're going to go for the Diamond Glow. Some people that maybe are more sensitive, rosacea prone, don't like that a little abrasiveness, may want to do the hydrofacial. But they're both great treatments. It's nice and all one, no downtime again, non-invasive, plumping, hydrating, protecting, recommended for everybody. We can definitely customize them both too, which I love. So I feel like most patients like their treatments personalized. Now, it's
Yes.
not one size fits all. So with both, we can customize whether you're focused on fine lines and wrinkles, whether you have acne and you need more cleansing, pore
I have
clarifying.
all of that. All of that.
No. And then even brightening, like you mentioned, you had a little melasma. We have targeted boosters and serums with both of these that can address that too. So it's very customized. You can come see me once or twice. You're never going to get the same treatment. We're always going to customize to your skin's needs.
Oh, that is great. I know that in the past when I've been there, I like the derma blades because it seems like just with age, my skin doesn't exfoliate as easily, and I've noticed like a little milia, which is very annoying and hard
Mhm.
to get out. So I like the derma blades, but sometimes I've been asked by the esthetician, "Oh, what would you like?" And I don't know. I just say I defer to your expertise, whatever you think. And I know sometimes I've asked for certain services. They say, "Oh, I think your skin's too dry. Let's wait till it's not the winter, or you look a little too sensitive. I think we should do this." So I really appreciate that guidance and that expertise. Can you talk about some of the special serums that you pick for one person versus another?
Sure. So with the Diamond Glow, that is specific to, it's an allergen product specific to Skin Medica. So for all those Skin Medica lovers, they have serums such as the hugely popular TNS Advance, the growth factors. They have the HA5 serum. They also have vitamin C, brightening, pore clarifying. Sometimes we can use two serums in one treatment. So that's a really popular one. Skin Medica is very popular. It also works with the Alley program. If you're familiar with Alley, which is an allergen program, patients get, it's a loyalty program. They get rewards. They can use their points with the Diamond Glow treatment. So that's a nice little benefit.
Oh, yes.
But it is specific to Skin Medica. Whereas the Hydrofacial, they have all sorts of hydrating serums, pore clarifying. They also have brightening. Um, it's more, and they also work with many different skincare lines, such as Zeo, Elastin, Sente, where you can add boosters. So it's not product specific, it's a little more branched out. So they're both great um, treatments, good for everybody.
Mm-hmm. So, how often do you recommend this treatment? Is it based on just the woman's time and her pocketbook expenses, or do some people need to come more frequently depending on their skin problem or skin concerns versus other people who maybe don't have as many issues?
Right. So I usually recommend 4 to 6 weeks is ideal for these treatments. But if someone comes in and they're having certain problems with acne or need a little more cleansing, maybe we'll have them back a little more often just to get their skin controlled. And then from there, they can come back every 4 to 6 weeks as needed. Like I said, I have patients that come once a month if they love the treatment. And it does matter what you're doing at home. So if you're doing some maintenance at home as well, you're maintaining what we're doing when you're coming in for the treatment. We're the boost, but you got to maintain that boost once you're
That's
home.
right. Kind of like, you need to go to your dentist to get your teeth cleaned at least twice a year, but every day you need to take care of, brushing and flossing and caring about your dental health. So tell us about what you would recommend for skincare routines because I feel like there's just so much conflicting information out there. People are told to wash their face twice a day, only once a day, use this, don't use soap, use that. You need to use only exfoliate once a week. Some say more. So it's just confusing. And I've read so much and I'm a physician and I'm still confused.
Well, you never want to over exfoliate, that's for sure. So if you're using certain products, such as prescription creams that people may use, you may not want to use too many exfoliating cleansers. Definitely use a
Such as,
facial cleanser,
are you
like
talking
a
about
retinol.
the retin-A's? And I think
Yeah.
some, and Differin is a retin-A derivative. And isn't that now over the counter, I believe?
It is. It used to be prescription, now over the counter. So I always recommend having people come in for a consultation because these are things that we need to know what you're doing at home before we even put you on a regimen. And a lot of times I recommend people stopping their exfoliating products, the retin-A, before their treatment too, because it can enhance and make you a little more sensitive to treatment. So consultation is definitely recommended so we can go through all that. But as far as a basic skincare regimen, that could vary from person to person. Um, you may come in to see me, and your friend may come in to see me, and I'll put you both on two different regimens.
Hmm.
So the two most important things I think is you just want exfoliation of some sort, retinol, glycolics, um, antioxidants. That's another definite product, and there's different types of those even, and of course SPF for protection. If you're not protecting your skin, everything we're doing is not going to work as well.
Absolutely. I mean, after I had that melasma taken off my forehead, I not only put SPF, UVA, and B on 365 days a year on anything that could get remotely exposed to sunlight, even in the winter on a cloudy day when I'm in my car, those rays can penetrate. That I don't even go out and get my mail without my visor on. And I've even been known to water ski in the summer and try to keep my visor on. It doesn't always work, but
Right.
and reapplying, every couple hours. Sometimes I'm not so good about that.
Right, right, which is understandable. But we have products that even, a brush on sunscreen. So if you're done up and you got your makeup on and you're outdoors for some event, you're not going to ruin your makeup by reapplying with a liquid
Uh,
sunscreen. We have little brush on powders with SPF 50 that really work. So, that's a really good thing to put in your purse and,
I didn't
touch
even
up.
I didn't even know about that. So I'm next time I'm in the store, please get that for my bag. Um, Now I know a lot of people are really sensitive to Retin A, especially the prescription varieties, and I think one of
Mhm.
your estheticians recommended that I get an alpha ret, which is like great because it has a little tiny
Yes.
bit, but not too much. And is it glycolic acid that it has on as well with it?
Yeah, it's a combination, and it's formulated specifically for people that can't tolerate retin A or retinol. It has other ingredients that help to hydrate and counter some of those side effects, that you may get: redness, irritation. So it kind of, you pay a little more for those products, but it's definitely worth it if you can't do a retinol, retin A.
Mm. And then I had questions about toners, like who needs to use a toner? When do you use a toner?
So toners are great. It helps. What it does is it helps get your skin to the proper pH. That's what a toner is. It helps. We have some that after a cleanse, you're going to tone, which is going to help get off some maybe excess cleanser you may have on. Prep the skin with getting it to a proper pH. Sometimes, I don't know if you've noticed, you wash your face feels a little tight.
Mm-hmm.
That's your pH. That's your pH off. So it can get that back. It can hydrate and soften. So it's a good product to use. It will help your next step in skincare. So after a toner, then you're going to apply your serums and all of that.
And so tell what do serums do and what are the serums? Is it vitamin C? Is it the growth factor serums?
All of the above. So yes, we have hyaluronic acid serums for people that are maybe more dry. It's going to hold water and bind it into the skin. Our bodies we don't produce as much collagen and hyaluronic acid and all that good stuff. So sometimes you need a little, help with that. So that's what a hyaluronic acid does. Vitamin C serums, they come serums, lotions. That's going to be your protection. They help protect from free radical damage, the lights, blue light from your computer screens,
Really?
all of that. Yeah, that's not good for your skin. And I know some of our secretaries have three screens pointing at them. So your skin is getting damaged a little bit by those as well. Not just the, sun. There's other lights that can be damaging.
Wow. Wow. That's really something.
So topically, vitamin C is a really nice product. I do recommend everybody should use a vitamin C.
We'll be back after a quick break.
Are you ready to unlock your full potential? I want to introduce you to the Fit, Healthy, and Happy podcast, a powerful resource to transform your life today. With expert interviews, practical tips, and inspiring stories, this podcast is your roadmap to lasting wellness. Here's what a listener has to say.
I used to struggle with my health, but this podcast changed everything. It's like having a personal trainer, nutritionist, and life coach totally for free.
With over 2,000 five-star reviews, we're a podcast you can trust. The Fit, Healthy, and Happy podcast, available now wherever you get your podcasts.
Yes, I've added that. And it's interesting you talk about the hyaluronic acid. As I've gotten older, my skin's a little drier, so I just added that. And I know we prescribe an over-the-counter hyaluronic acid actually as a vaginal moisturizer that a lot of women find very helpful. And sometimes it even actually helps the epithelium a little bit as well. Now, one of the things I've wondered when you're using these products and you don't want to overuse them, you don't want to underuse them, they're expensive, so you've got to use the right amount. I always wondered about inactivation. Like if I put one on and then I put another on and then or when I put my sunscreen on, I guess you put your sunscreen on after all of that and then you put your makeup on.
Yes, yes. And you can find, I know it's a lot. And if you look at products, a lot of them will say use twice daily. Do I use all of them twice daily? No. You can kind of customize. So they're not going to inactivate one over another. I kind of like to put one on, let it get absorbed in the skin. Our products that we carry are very concentrated. You don't need to, douse your face in these. One good pump would be sufficient for your entire face. The only thing that I always tell people, the growth factor. So if you're using anything with a growth factor, which is basically a product that has peptides that help to nourish and energize your skin cells, that should always go on first, whether you use it day or night or both. That is one thing you just want to just get into your skin before anything else. It almost is
Oh.
like a communicating to the skin cells. So that's the only thing. Other than that, there's no wrong way to apply products. I have my way, but Amanda and Cynthia, our other estheticians, may have their way. I have one rep that said she puts all the products in her hand, mixes them together, and puts it on her face. So, I mean, there's no right and wrong with skincare.
Although you don't want to get it in your eyes. I don't know how many times I've
No,
had sunscreen in
not
my
in
eyes.
the eye.
And my fair skinned son said that like the worst memory he has in childhood is me smearing sunscreen on his face. Like he always says he's half albino and half amazing. So he's so fair skinned that it would burn in his eyes. So I guess you do have to kind of be careful. The skin around the eye and the eyeball itself are, not where you want to be applying it necessarily.
Right, right. Well, yes, exactly.
Can you talk about some of the other areas? Like, do you do hand peels, neck peels, the décollage area, which certainly shows aging?
Yeah, so we do have peels that target certain areas of the body. Hand peels, they help, a lot of the hand peels targets the hyperpigmentation, sunspots, damage, wrinkles. Our hands and our neck are, and actually the eyes, are three sensitive areas, thinner skin. So the peels are specifically targeted to those areas. So photo damage, sun on the hands, it can help lighten that. Eyes, it helps under eye circles, plumping, fine lines. The neck and décolleté, a lot of that is texture, sun damage, which, your chest gets hit all the time with sun. And I always tell people, don't forget the neck. So
Mm-hmm.
you're using products on your face, run it down your neck and chest always. Those are usually eyes, hands, and neck are the first things to show your age or give away your age. So you always want to protect those.
Do you do any spot treatments of like senile lentiginous age spots that like higher concentrations like a glycolic acid, or is that something that people need to go see their dermatologist for?
No, we do targeted boosters with our hydrofacial. So those can target hyperpigmentation. So we can focus on that. We have a derma builder, which is full of peptides that will target the fine lines with the hydrofacial treatment. But most of our treatment is just specific face, hands, neck.
And what about lips?
Lips, we do have an eye and lip peel. What that's going to do is help to plump up a little bit of that border around the lip. So a lot of times people have those little smokers lines,
Yeah.
around the lip. Some people don't even smoke. This is how, what happens. So that's going to help that. Usually those are really recommended in a series because they're sensitive areas. We can't go too harsh with those.
Now, I know I booked some appointments several months in advance of my two sons' weddings because, of course, you want to look good for these big events. Do you have any timing that you recommend? Obviously, some things do require more treatments, others can just be maybe done a couple weeks in advance. And any guidelines on time?
Yes. So if there's some like concerns that you really want to focus on, like lines and wrinkles and all of that, I would start a few months earlier. The week of the wedding, I always recommend doing like a nice dermablade and a light peel. That kind of gives your skin a fresh um, glow, um, and kind of smooth surface, because a lot of these weddings you're getting your makeup done by professionals. That gives you a nice surface. So at the dermablade and a light peel, we call them the red carpet peel. One of my favorites is the luminized peel.
Oh, I've
I
had
always
that.
tell,
I like that.
yeah, yeah. So that's great the week of, because your skin, it is a process. So the week of, you have the peel, this treatment done. In a couple days, your skin's going to look the best. I just did a bride this week. She's getting married this weekend. We did a dermablade and a hydrofacial. So again, like I was talking earlier, it's so we can customize to what you need.
Now, some of the locations, I know you mentioned to me that because you guys provide services in Northeast Ohio at different locations, but you don't have all the high tech machines at all the places. So, any tips that way?
Correct. Correct. We have, if you're interested in hydrofacial right now, where it's available at the Beechwood location. I do a lot of those. Those are very popular treatments. The Diamond Glow is located in our Sugar and Falls and the Avon, REJ locations. So, some people, they want one, but you're really getting this, they're very similar. Again, the only difference is the type of exfoliation, but they're great products. Um, and you can switch off. You can do one, the other. Um,
That's good.
so it's depending on location and what. Yeah.
Good to know. Do you do back peels? I'm just thinking about my one son that's got back acne that apparently isn't all that responsive to Accutane. He's been on a couple courses of Accutane through the dermatologist.
Right. Yes, we do. We do back peels. Well, with our back treatments, it includes extractions as well. And we do salicylic. I've even done a little stronger peels, the perfect derma peel on the back as well. A lot of girls, especially, prom time, they're, wearing their off the shoulder gowns and dresses. And so, they're concerned with the back acne. So we can even do half back, full back. But yeah, that helps to fight off acne, and calm it. But I always recommend doing it ahead of time, not week of, for that,
Sure.
because it is going to cause some flaking and irritate, may be a little redness. So you want to start it ahead of time.
And what about some of the deeper facial peels that do have downtime, like for severe acne scars? Or is the perfect peel a deeper one that someone's going to have some downtime?
Well, so these peels are good for all skin types, and different skin concerns. So if you have a little deeper wrinkles, texture problems, issues, acne scarring, this would be a great peel for you. It's the perfect derma peel. It's one of my favorites. It works like clockwork. I can tell you what to expect. And it's about 7 to 10 days downtime, which downtime means that really, so you're going to have some flaking, some skin coming off, and that's what we want. But we just want to make sure you don't have something coming up that weekend. So it is a timing thing. We'll let you know. It's like, again, 7 to 10 days. You do have some at-home care that you do have to do with this peel. But again, certain conditions may require, such as acne scarring, maybe a series, but we can let you know ahead of time we think your outcome may be. But it definitely helps hyperpigmentation, acne scarring, improves texture, a little deeper wrinkles. It'll help, but it's a great peel. Sometimes you just want to do a nice boost and nice exfoliation. They really become a really popular in the fall after summer. Just to get rid of that, slough off that summer skin and get to healthier, brighter skin coming forward. So it's good for
So if someone
everyone.
had it done, say, on a Friday, could they plan to go back to work in public on a Monday?
You can go back to work. You'll be a little flaky.
Okay.
It's nothing that's going to keep you at home and hidden in the house. But you will have usually the second day is, you may feel a little bit, you may be a little red. Sometimes you get a little itchy with these peels. So we do have a post peel kit that we will give you to help with all of that, and really clear instructions on what to do, what to expect.
And I imagine
So
avoiding sun, it would be very.
always. Anytime you're getting these treatments done, the peels, well, we always leave you protected with a lot of our treatments. This one, you have to really you should be out of the sun, direct sunlight. You can put it, and also use a sunscreen during the peel
Mhm.
process. And we will give you some of that as well. It comes with the
So is
kits.
this perfect peel something newer? I remember several years ago having a peel where my skin was real tight and red and flaky, and I just remember feeling so irritable and beside myself that I never had another one done after that.
Well, yeah, it's something that like it's good for first timers, but we really try to tell you what to expect. So again, the consultation is really recommended, so we know what your goal is. But there's all sorts of peels. Not all peels actually peel. Some just brighten and tighten the skin. Some you get some flaking. Some you actually are taking scissors and cutting the skin off that's hanging.
Wow.
So yeah, so there's a variety of peels. Some prefer lighter peels more often. Some people prefer a little heavier peels every once in a while.
Hmm. Well, I definitely have to sign up for that hydro facial for sure, and another diamond glow. I just love those. Now, tell us a little bit about your aesthetic corner and like why someone might want to come in and buy products. Are they medical grade as opposed to maybe what you might get like at over the counter somewhere else?
Yeah, so most of our products are medical grade products, which really means the active ingredients are going to be higher in concentration than what you're going to get over the counter. You're going to see vitamin C's, you're going to see retinols, at your drugstore, but you're not going to get the concentration you're getting from medical grade. I feel like you're going to see more results quicker. And we can help you select as well. So if you come to the store and you had some questions, we're happy to help you select the right product for your
And
skin.
what generally are your hours at the store in the Crowell building on the sixth floor?
Well, it can vary depending on our staffing issues we have these days, but 8:30 to 5 is our, usual hours. But we also have an email, an aesthetic corner email. It is on our website that you'll be able to see along with phone numbers. So you can call. We do ship products. It's free shipping, so you don't have to come
Oh,
downtown.
that's nice.
Yeah, so we have a lot of repeat purchase, buyers or patients that we've seen that love their products and they don't want to come downtown to main campus to buy them. So of course we're going to ship them out, and we do offer products at all of our locations that have estheticians: Beechwood, Chagrin Falls, and Avon, and we can help you
And you
select.
have great products. I one of my long-term dear sweet patients who I'm sure is probably going to be listening to this podcast at one point, she had to have a dermatologic procedure done, and her skin was kind of irritated, and I said, I bet sickle fate would be great on this. And because her dermatologist or derm surgeon, I don't think said to do anything, and I ran upstairs to the shop and bought it, and I had not known about it, and it's a combination of what, zinc and sucralfate and copper, I think.
Yeah, so it's a nice healing cream.
It's
Love
so
it.
good for healing. And I thought, this is exactly what you need. She's very sensitive and fair skinned. And, she was like so happy I ran
Mhm.
upstairs and got it for her. But I give
Yep.
that as when I go to baby showers for baby gifts. I use it for stocking stuffers. And I remember when I first found out about it from one of my dermatology friends, I'm like, gosh, why didn't you tell me about this sooner? Because everybody in my family has their own tube. And it's just
Right. I always tell everyone should have one of those in their house. It's good for burns, little, just minor stuff. It helps to soothe and heal the skin.
mhm.
So yes,
And I've
I use
also
it all the time.
bought some products I like your Revitalash, which helps eyelashes grow.
Yes, it does. And it's uh, non-irritating. It's safe. It's basically a serum, a conditioning serum for the lash and brows. We also offer for the brows as well. So it's going to get them healthier. They won't be as brittle. They'll be the lash one even gives your lashes a little curve, a little curl to it. So it's kind of nice. And I do see results when I stop using it. I can tell.
So, you've just been such a wealth of information. We really appreciate you joining us, and I hope you'll come back in the Sunflower House to give us updates. And I've certainly bought gifts, or purchased services for people as gifts. I think I might want to do like a deep back peel for my son, it sounds like. Can people buy gift certificates, or is there a way to arrange if somebody wants to buy gift cards or?
Unfortunately, we can't do gift cards at the Cleveland Clinic. I would love it if we can find a way to do that. Um, but there is what you can do is for the Diamond Glow and Skin Medica peels, stuff like that, Skin Medica product. You can buy gift cards on their website that you can be used for treatments such as the Diamond Glow, but we don't offer in-house gift
Okay.
certificates.
And so if someone wants to call to see if the store is open or make an appointment, is it 216-444-4004?
It's 216-445-5276. That is the store. The 444 4004 would be the cosmetics scheduling.
Okay.
And if you go onto the website, they do have specific locations: Beechwood, Chagrin Falls, and Avon. They're direct front desk scheduling lines too.
And the website is clevelandclinic.org/beautiful you.
Correct. And you'll find our whole department website, which includes not only skincare services and products, it'll include other things such as lasers and surgical procedures, cool sculpting, just everything that you can, want to know about as far as cosmetic.
Well, thank you so much, Lori, for joining us in the Sunflower House. And thanks to our listeners for tuning in to the Speaking of Women's Health podcast. Please be sure to subscribe anywhere you get your podcast: Apple iTunes, Google Podcasts, Podbean, Amazon Music, anywhere you listen to podcasts. You can subscribe for free to listen to our Speaking of Women's Health podcast. And please give us a 5-star rating. That helps us move up in the ranking. And I sure hope you'll join us back the next time we're in the Sunflower House.